warm welcome to Invest Africa. I'm Nozipho Mbanjwa, and thank you for making the time to join us. Now, as Africa's economies improve, the demand for better healthcare will also increase, but few countries on the continent are able to spend the required $34 to $40 a year per person that the World Health Organization considers as the bare minimum for healthcare. Now, the International Finance Corporation also estimates that about $30 billion in investment is needed in just this sector, and aid alone cannot and will not fill this gap. Joining me to share their insights on this matter is Dr. Anuschka Coovadia. She's the head of healthcare for KPMG. And in Nairobi, I'm joined by Dr. Victor Ngani of the Kenya Medical Practitioners, Pharmacists and Dentists Board. Thank you so much for making the time to join us. Anuschka, let's start off just by getting a sense from the KPMG perspective. What is the state of healthcare on the continent?
Nasipo, healthcare is in a tremendous state of flux. We're dealing with a changing patient population. We have trends of rapid urbanization, poverty, inequality, and a huge geographically and economically and culturally diverse population. And so as the population is changing, the healthcare systems are battling to keep up with these changes.
So we're hearing that we're in a space of a changing system, and one that healthcare systems are unable to keep up with the demographic demands. Victor, let me come to you, and let's get a really focused view coming out of the Kenyan context. Does the same hold true for what we hear from Anuschka for the Kenyan context?
Yeah, absolutely. We are seeing a bit of a change in the Kenyan context. Since independence, healthcare has never really been a priority. But with the increased democratic space, the changing political situation, and with increased economic power, we are seeing two things happen. People are beginning to take healthcare seriously. We are not yet where we want to be, but at least the conversations on healthcare beginning to happen. And then at the same time, as we get economic empowerment, we are having people in a state where they are better able to meet the cost of healthcare. Well, this is still applies to a minority of the population, because most of the Kenyan population are still way below the poverty line, but there is some movement in this area.
Victor, I want to stay with you for a moment, because what you're highlighting is that there is increased consumer awareness of the need for healthcare and a desire to access healthcare. But let's talk about the priority being on the part of the fiscus. Is government spending more on healthcare, and by doing so reflecting that this is a priority?
Well, unfortunately, one of our bigger problems in Kenya has been a lack of government expenditure on healthcare. I think we were party to the budget declaration that said we spend 15% on healthcare, but we've not quite done that. About 3 years ago, we were spending about 6% of our national budget on healthcare, and that figure has gone down progressively over the last 2 years. And in the last budget, we were spending about 4.8% of our national budget being allocated to healthcare. So we've been on a downward trend, and that has really left a big gap for us.
Anuschka, does that trend hold for the broader continent, that healthcare is falling off the radar as an investment priority for the various governments?
Well, on average, African countries spend about 6% of GDP compared to a global average of 9%. And what we also need to remember is that there's a huge latent burden of disease that is actually not being met over the last few decades. So I think that many African countries have committed to expending at least 10 to 15% of GDP on healthcare, but few have failed to realize this.
And let's stay on what they're spending on. Is this infrastructure? Is it access to medicines? Is it innovation and developing new patents? Where's the money actually going?
A large amount of the resources are used to finance existing infrastructure. Many countries are trying to upgrade infrastructure. And then in healthcare, it's inevitable that a large amount of your costs are human resources costs. Of course, medicines will be a stable proportion, and many African countries are obviously moving towards more generic utilization. But I think that the bulk of the costs still sit between infrastructure, your human costs, and then medicines.
And Victor, how does this compare with our East African experience, where the vast bulk of the purse is actually sitting with human resource costs and infrastructure? Does the same tally for that market?
Well, in Kenya, I'll give a very good example. I think this government has, for the first time, invested significantly in healthcare. And what they've done is they've allocated about 30 billion Kenya shillings, which is approximately $400 million, towards purchase of equipment. This is the single largest investment in healthcare over a long period of time. In fact, they're not purchasing, they're hiring that equipment. And that basically signals a slight change in prioritization of healthcare. Most of the healthcare costs go towards recurrent expenditure. We have not had significant capital investment. We are not building institutions. Some of the buildings we use for our hospitals are about 20 years old. We have machines in our institutions that probably are significantly outdated. And I think this is the first time we've had some investment. Now, what is it we are spending on a recurrent nature? I think it's salaries, still way below what they need to be. And in fact, we've lost a lot of health workers as a result. But we are not really investing additional funds into the healthcare system in Kenya besides this one plan to hire equipment. And there are deficits. In fact, if you look at what is needed, then you'd probably put human resource ahead of everything else, because we are seeing a continuous exodus versus a growing population that would be better served with having more health workers available to use this equipment.
So what I'm hearing from both Victor and yourself, Anuschka, is that there's a funding deficit, rather, that exists in the healthcare space. And before we get to the potential role that the private sector can play in meeting that need, let's just get a snapshot understanding of the cost of healthcare. Is that coming down? Is healthcare becoming more affordable for the average African?
I think that we have no idea what the true cost of healthcare is on this continent, because up to 85% of expenditure in healthcare is out of pocket. So it's very difficult for us to understand the impact that is leveled at a household level. Generally, most people, as in part of the consumer market, are experiencing increased costs to meet the basic healthcare needs of their family. And the greatest challenge that we face as an African continent is that we have a very low population who have prepaid healthcare coverage. And that is perhaps one of the greatest reformations that will happen on the continent over the next decade.
Prepaid healthcare, a quick one. Just give us a sense again of the kind of product offering we're talking about and how that enables greater access and affordability to healthcare.
Okay. So globally, we've seen more mature markets moving to universal healthcare coverage. And what this does is it removes the financial catastrophical effect from a family when it comes to their family getting sick. And essentially, there are many different sources of this funding. It could be private sector funding or state sector funding, but every citizen in the country has access to free healthcare. It might be a certain package or basic package of healthcare, but the entire population is covered by one form or the other of healthcare.
Victor, let's come back and let's come back to Nairobi and begin to interrogate the possibility of the private sector stepping up to the playing field and really engaging meaningfully with the public sector to deliver healthcare to the mass population. How would you describe the evolution of that relationship?
Well, I think in Kenya particularly, the private sector plays a very important role in provision of healthcare, primarily because due to many years of underfunding, the public sector healthcare system didn't quite grow. And there's an increased demand for quality healthcare. And this has been shown by what we are seeing happening in some of the private institutions that we have. Additionally, the private sector as a whole, not just the government scheme, but also other sectors, not necessarily healthcare, in the public sector would be key contributors to healthcare investments. In fact, one way to ensure that healthcare becomes more affordable, it's not yet more affordable. In fact, it's a bit more expensive in Kenya today. One way to make that more affordable is to have universal healthcare coverage. And the private sector would have to play a role in stemming this up and ensuring that the contributions that go towards this are channeled appropriately. In terms of private healthcare institutions, well, they provide leadership in terms of innovation, in terms of bringing in new medical services that then the public sector can borrow from. And I think one important area is as the Kenyan population become aware of these novel ways of treatment, that these opportunities actually exist, these possibilities exist, then we have this being imported and incorporated into a public sector. However, from the Kenyan perspective, for sure, unless we make a robust public system, a lot of people in my country will not be able to access meaningful healthcare, because the private sector currently accounts for just about 10% of the population who are able to pay. Yeah.
An interesting segue there, saying that the private sector is important and we need the investment from the private sector and the participation in terms of leveraging off those efficiencies. But without the public sector as a key partner, we're then going to miss the masses. Are public-private partnerships in healthcare working?
I think to date we haven't really derived effective public-private partnerships, besides for a few isolated great examples. But what we're seeing from our work across the continent is that once you've got a source of funding available, so once you've got a source of funding from universal healthcare coverage, the private sector are very quick to organize themselves to provide services to that market. So we definitely are seeing a greater appetite for public-private partnerships. And it's very exciting to see a number of large global private equity funds investing in healthcare in Africa and building meaningful public-private partnerships for the segment of the market that is currently not being catered for by the private sector, but actually have enough resources to buy private healthcare services.
So it certainly sounds like we're dealing with the tiered system. Let's take a short break. When we come back, we begin to also look distinctively at the affordability of private healthcare on the African continent, and in particular, whether there are further investment opportunities in the sector. We'll see you in 2 minutes. Welcome back. You're still watching Invest Africa, and with me tonight I still have my guest. That's Dr. Anuschka Coovadia. She's the head of healthcare for KPMG, and Dr. Victor Ngani of the Kenya Medical Practitioners, Pharmacists and Dentists Board. Now, before we went to the break, we were grappling with this idea of increasing the accessibility and the affordability of healthcare broadly across the continent. Let's focus now on the provision of private healthcare, and I want to start in Nairobi. And Victor, I want to bring you in, but perhaps give us an understanding of how big is the private healthcare market in Kenya compared to the broader public market that is available?
Well, that is not a very easy question to answer, because there are very many factors affecting which would determine how to answer this, because a lot of people who are able to afford it will almost always go into the private institutions, primarily because there's a very big difference in terms of quality between the private institutions and the public institutions. Unfortunately, in terms of raw numbers, the number of Kenyans who can access these better services in the private institutions are less than 10%. So in terms of the quality of healthcare, one, it's possible to say that the bulk of quality healthcare is delivered in the private institutions, while the bulk of the Kenyan population can only access public institutions. And therefore, the private sector plays a very significant role in our country at the moment, basically in terms of giving quality healthcare to the population.
Anuschka, would it be safe to say that's possibly a reflection of a continental trend where private healthcare is much smaller than public healthcare, and also inaccessible from an affordability point of view?
Yeah. Nasipo, in South Africa, about 16% of our population are covered by private healthcare. So the majority of the population rely on the public sector, and this is a trend that we see throughout Africa. Private healthcare is inaccessible at a secondary and a tertiary level for the majority of the population. But ironically, large numbers of the population rely on primary healthcare services from a private sector. So what we're seeing is a very vibrant, large primary healthcare sector that is actually underestimated on the continent.
Now, if we're saying South Africa has relatively stronger numbers in terms of private healthcare provision, how much of this is because we've got a more mature medical aid industry? One would think that in the absence of a medical aid industry, the private sector is not going to want to go into that market.
I think that the minute you start seeing people entering formal employment, you start to see a market for insurance products. And throughout Africa, there are a lot of insurance products that look after employee benefits, and healthcare tends to come in as part of that package. So the more people who enter the formal economy, the greater the coverage will be from the private healthcare sector.
Victor, I want to extend this idea of the penetration of insurance products and financial services broadly as being a very important catalyst for the provision of qualitative healthcare in Africa. Do you think that this is a lever that would make a difference in the Kenyan market?
Absolutely, and I think the Kenyan population is alive to this, as well as the policymakers, to the extent that we are seeing a lot more investment, a lot more energy being directed towards this, ensuring that insurance cover improves. Currently, we have a social insurance scheme, the NHIF, that covers about 20% of the population. We have probably an additional 10% of the population covered by private insurers, though they must have dual insurance from both the national scheme as well as the private companies that they work for. Now, one of the bigger challenges we've had in our country is that everybody needs healthcare, but the ability to pay is significantly different from region to region. And if you are able to ensure that everybody has access to some form of insurance, then we will see a greater ability to pay, lower default rates, and greater profitability from the investments in healthcare. And recently, the National Health Insurance Fund increased their rates significantly. There are issues in that regard as well that are not very straightforward, but definitely increased insurance creates a new opportunity that allows greater investments and greater returns due to lower default rates. Yes.
That's an important point that you raised there, Victor, about the National Health Insurance Fund, because South Africa is on a similar journey. Yes. We're trying to figure out how we're going to fund a national health insurance scheme. Anuschka, give us a sense of whether you think this is something that within the South African market can be funded, will have the requisite consumer buy-in, and could work as well as other markets like we've seen in the UK and elsewhere.
It took the mature markets many years to set up a national health insurance fund, but it is clear that it is the only way for us to achieve our economic development growth targets and social cohesion. So the government have committed to working towards implementing a national health insurance fund. Currently, we're waiting for the issuing of the white paper, which will come out hopefully in the next few months, and that will determine how we move forward as a country to progressively realize it.
Now, if a national health insurance fund were to come into existence in South Africa, and rather I should be saying when it does come into existence, who's going to get the negative backlash off the back of this? I'm immediately thinking private healthcare providers who now can't rely on just their medical aid revenues to come in, because there is an alternative for consumers to tap into.
You know, nobody really knows right now, so we're still waiting to see what the terms of the fund are. But there are potentially huge opportunities for the private sector. So there is the opportunity that the private sector will be able to provide services to the members of the population covered by the National Health Insurance Fund, which will open up huge markets for the private sector. There is also the opportunity that private medical schemes and insurers may be able to administer part of the funds. So again, this is another opportunity for the private sector to meet the needs of the country.
So, Victor, Kenya is certainly a couple of steps forward ahead of South Africa when it comes to just having a national health insurance fund. But maybe if you could share with us some of your insights in terms of what works and works well from the national insurance scheme that Kenya currently has, and what doesn't work, so that the likes of Dr. Anuschka in South Africa could pick up from that and say, this is not to be extrapolated and replicated in any other market.
Well, one thing that works definitely is that people who ordinarily wouldn't have access to healthcare from a financial standpoint then have an opportunity to access healthcare. And that's the underlying principle, really, and it's definitely a good thing for the country. But what has failed to work in our country is are issues of governance and integrity, transparency, accountability, to an extent that a while back, about 2 years ago, the insurance fund was spending about 45% of all its collections on administrative duties and only 55% on meeting the cost of healthcare. There have been some reforms due to activism from various bodies, and I know that as of last year, that ratio had dropped down to 30%, and there's an intention to drop it down further. Now, the other thing is, we had a difference in allocation of funds. A large chunk of the monies were going to friendly institutions versus public institutions, while that's probably not ideal. But I also want to say that just going back to an earlier question, in a space as exists in Kenya today, in East Africa today, where there is a greater economic empowerment, a growing middle class, a greater appreciation of health insurance, a greater interest in healthcare, there's a very big potential for private sector investment in healthcare. And in fact, that's one thing that we're beginning to witness. Many companies are coming in from India, from Europe, bringing in their products. The recent acquisition of equipment, this is direct public private partnership where the government has injected $400 million to ensure that there's equipment being provided by the private sector to our public institutions. This is a very exciting space, I must say, lots of potential going forward. So
an exciting investment opportunity for the private sector. I want us to shift gears for a second, Anuschka, and talk about the skills drain in the medical field. For many, many years, we saw other markets like Europe benefiting tremendously from the medical skills that we had grown in South Africa and Africa broadly. Is that changing? Is that trend of a loss of skills starting to turn around? And if it's not, why not?
Nosipo, it's funny because when I qualified, more than half my class moved overseas to the UK. But now the feeling that I get from young graduates is they want to be in South Africa. They want to stay in Africa. They want to work amongst their communities. They just need the enabling environment. And I believe that this is changing. I believe that we are starting to offer healthcare workers a long and prosperous career path. And that will really drive our retention of our healthcare workers.
Victor, I want to bring another element of the skills conversation because Anuschka is suggesting that there is a change for the positive in terms of redirecting the skills back onto the continent. But what about the battle between the public and the private providers when it comes to fighting for skills? There's always been a sense that private players poach skills from the public sector, and this has always created some degree of tension and mistrust between the two sectors. To what extent is that true and reflective of what you see in Kenya?
Well, first, just going back a little bit, I just want to express my pleasure at discovering that in South Africa, doctors now want to stay in South Africa. In fact, about 3 years ago, we were beginning to see a reversal of the brain drain that we had in our country where we lost most of our doctors. In fact, in 2007, a report appearing in the British media indicated that 52% of our Kenyan doctors had gone out to Europe. Now, we had reversed this briefly at the end of 2011, 2012. But unfortunately, that's not the case anymore. If you follow Kenyan events, you realize that there was the evolution of healthcare, where healthcare was sent out to the local governments, about 47 local governments, and this was done in a situation that wasn't very well thought out, and it was a bit hurried before structures were put in place. And what happened is that consequently, doctors weren't being paid on time. There were lots of disruptions in terms of the human resource processes. And consequently, we've lost about 50% of the doctors we had in 2011, down from 3,300 to about 2,200 doctors this year. That's quite tragic. And I don't think that we are at that point yet where we are retaining our doctors. I think what's being experienced in South Africa is quite unique and very different from what we have in Kenya today, and the same applies to the nurses. Now, with regard to the difference between the public sector and the private sector, again, there are very fundamental issues that we have not really been able to address, and this is because of a lack of keenness. The tragedy is sometimes that in our country, we don't really value the opinion of the players in the health sector, so that you'll find decisions on healthcare matters being made by lawyers and other categories of workers, and whereas the key bodies in healthcare are a bit neglected. It's a political space that needs to change in our country for us to begin to see a difference. And what has then happened is that even though there are fewer private facilities, they have probably more health workers than we'd see in the public sector.
So, Anuschka, as a final question, you're engaging with African governments across the continent. From a policy priority perspective, what are you advising them as KPMG in terms of growing the depth, the muscle, the strength of their healthcare provision?
Healthcare is an ecosystem. So a part of it is clinical services provision, but there are many other parts that are involved. And these involve governance, regulatory structures, distribution services, supply chain management, organizing providers into teams, utilizing new technologies. So our work is very diverse across the continent. And a lot of it has got to do with bringing disruptive innovation into markets and allowing us to really leapfrog forward instead of following the same trajectory that other mature healthcare systems have followed. And I think that to a large degree, these changes are being driven by mobile technology and technologies like telemedicine. So a lot of the government policy changes are looking at how they can implement universal healthcare coverage in this changing landscape and this ecosystem.
So it's a changing landscape, it's an ecosystem, but it's one that's certainly ripe and fertile for future investment and more participation from the private sector. A very big thank you to my guest tonight. That's Dr. Anuschka Coovadia. She's the head of healthcare for KPMG, and Dr. Victor Ngani of the Kenya Medical Practitioners, Pharmacists and Dentists Board. Now, for you at home, remember that we do welcome your comments. The details as to where to send the comments are on your screen. For myself and the Invest Africa team, it's goodbye.